It'll take me longer to come up than it will to ask the question, I think. Just, I only have two questions, and I'd like to ask the second one after the first one is answered, if I might. The first question is simply, we've heard you mentioning a number of times the plan that's being discussed with the state and so on. Could you just explain to us the plan? I don't know what the plan really includes or excludes, so if you could just help us all understand what the plan you're discussing with the state is, that could be helpful.
Your second question?
I wanted to ask that one after it's finished.
Well, why don't you ask him?
The second question may or may not be pertinent, depending on what the plan is. And that is, I was here, along with many others, when the alliance was being formed. And one of the things that we were certainly assured very clearly is that Benedictine Hospital, with the alliance, would always maintain its Catholic identity and the values that go with that identity. How are you planning to explain to the public the betrayal of that assurance?
Thank you.
Thanks.
Dave,
Okay.
what's the plan?
The plan that we've been working on the last, well, actually now over 90 days, includes a description of the service configuration, what services we will provide, location, physical location, what is it, where is it located, what will it look like, what services, to what extent can we provide those services. All of that is in the plan. The number of beds, the number of, the pieces of technology, all of that goes into describing how we're going to provide the services within the facility. As we said, the preference is the larger facility so that we can house as many services as possible that we can support and that the community will support going forward. So the plan is an articulation of that service configuration and the delivery system to provide the care.
If somebody were looking for something concrete, something that they could touch and look at or read, what would the plan be? Would that be the certificate of need application when it is filed?
That would be the acknowledgement of the approval of that plan.
Will there be any kind of document that the public can see prior to the submission of the certificate of need application?
Well, I would expect once, and again, it's critical that we receive the approvals before we start describing what that plan looks like and will act like. So to the extent that we can get assurances through the approval of the plan, then obviously we would want to describe the plan. But it's dangerous when we're not sure what it will look like to go forward prematurely in describing what services and what they will look like and where they will be located.
In what way is it dangerous? What's the risk?
Not being able to provide it
Okay.
and not getting approval to provide it. And that is, could cause some tremendous amount of miscommunication. And
Could it also alter the way you execute the plan?
it could. And the idea is to receive as much feedback as we possibly can, engage the constituents in the development of the plan, and then get the approval that we can support.
Next speaker is Jack Grogan.
The second question?
I'm sorry, I completely forgot about the second question. The question, I'm not going to use your words, but the original plan in 2008 was a promise to the community that Benedictine would remain a religious institution. How do you explain, which I think is exactly what this forum is about and what we've been doing, but how do you explain the reversal of that position?
The community can't support two separate hospital facilities. There isn't enough revenue, it's not economically feasible. The community was loud and clear in saying that they felt that the physical location of the single campus should be on Mary's Avenue, the current location of Benedictine Hospital. We listened to that, but very clearly in the forums, I tried to make sure that people who were indicating their preference for Benedictine were not speaking in code, telling us that they were choosing Benedictine because it was a Catholic facility. We've said all along from the beginning of this process that only one hospital can survive, and it has to be non-Catholic because it has to provide all services. We have tried our best in this community to maintain the two missions. It's not economically feasible. We made commitments. We tried valiantly for 4 years. It didn't work. We can't afford two hospitals, and the DOH will require that we provide full reproductive services on a single campus. I'm sure people are disappointed by that decision. I'm sure that people on both sides are disappointed by that decision. But the choice now is not whether or not to close one hospital or another. The choice is to decide how to make one hospital survive so that we have health care in this community. And that's the choice we're making.
Next speaker is Jack Roby.